Well, welcome to today's update. Thank you for coming back. Now, there's quite a few things to report on internationally today. There's some concerning reports of corruption, for example, in some parts of the world. And as time permits, I want to look at what's likely to happen over the rest of 2020 through the eyes of some senior scientists and scientific officers, and possibly look at some vaccination progress as well. But let's start off with a review of what's going on in the United States. Now, the cases, well, we've watched the cases rise, haven't we? We had a long list of them, the 40,000 cases per day, then it was up to the 50,000s. Well, in the last 24 hours that I've got figures for, there were 77,000 new cases officially diagnosed in the United States. A rapid increase in growth. So we are seeing this exponential growth that we had feared. And now we are well over 3.5 million cases in the United States. Deaths, 138,000. Hospitalizations at the moment are currently 56,000. Hospitals are in some areas coping, in other areas they are under significant strain, and more on that later. And infections are rising in 41 states. Now, the debacle, and I use that word advisedly, the debacle about masks. So let's look at this graphic first of all here on the second screen. Now, these are the states that are requiring face masks to be worn, where they're mandated. So Washington, Oregon, California, Nevada, Colorado, must be New Mexico, Texas. We could go around. You can see your state there, the ones that are mandating mask wearing. Kentucky, West Virginia, challenging my geography now, Michigan. Anyway, you can see your state there. So they are the states where mask wearing is currently mandated. And the grey areas, of course, it means that mask wearing is not currently mandated. But, interestingly, this is the list of retail outlets, the big ones, Walmart, Publix, CVS, Target. All of these places now are making wearing masks a condition of entry. But the problem, it seems to me, is who enforces this mask wearing. Even though the shops have made it mandatory, and I saw this appalling picture, a couple of appalling videos on NBC that I've just seen this morning, where a man pulled a gun in Florida because he wasn't wearing a mask, and presumably some other responsible citizen had advised that he should wear a mask. And I mean, he pulled a gun on him. I mean, why on earth would you have a gun at a grocery store anyway? And then to actually pull it out, to threaten to insert a metal projectile through someone else's tissues, to cause massive disruption to their vasculature, to cause massive tissue damage, to cause unquestionable injury, and potentially to kill them. To threaten to do that is just outrageous. Utterly outrageous. But the video's there, watch it on NBC News. Utterly appalling behaviour. And I just can't help admiring the gentleman who advised that he wore the mask. But to pull a gun on someone, I mean, think of the implications of that. It's just unimaginable. Now, Utah, again on NBC News, a packed room to talk about, I think it was masks in schools. And I estimated about 5% there were wearing masks. And when I say these people were packed in, they were absolutely packed in. And the conveners of the meeting rightly adjourned the meeting because people refused to wear masks. Just quite incredible that this debacle is still going on. Now, this one probably takes the biscuit. I was taken aback at this. The governor of Georgia, now I don't know his name, her name, I didn't check it. He or she has banned cities from requiring masks. So the governor of Georgia has actually said that counties and cities are not allowed to mandate mask wearing. I mean, it absolutely takes the biscuit. The science here is beyond dispute. I became convinced in March, along with most other scientists became convinced in March. So we're now March, April, May, June, July, 4 months later, and here we have a very senior politician saying, no, you can't force that. Absolutely incredible. And not surprising, we're seeing the exponential rise, unfortunately, in the United States. Now, testing, long lines of cars. Testing 48 hours up to 2 weeks is the reported times. Lots of people aren't getting the test results back for at least a week. Now, I haven't studied this yet, but this is in the Lancet, the medical journal The Lancet, and I do hope to do this, time permitting, shortly. But the Lancet study is saying that if a test result is delayed by 3 days or more, contact tracing is almost impossible to reduce the spread. Because, of course, the whole point of testing is that we know who is positive. Therefore, we can identify their contacts and quarantine their contacts for 14 days. This is the whole point. But if the test result is delayed by a week or two, then do you remember who you met 2 weeks ago? Do you remember who you came into contact 2 weeks ago? Are those people now contactable? Well, of course not. It becomes absurd. So this Lancet study is saying if the testing is more than 3 days, okay, it's very interesting and potentially highly useful for the individual to know if they're positive or negative. But in terms of contact tracing, to reduce the spread of the pandemic, it's basically useless. So that means in terms of epidemiological spread, a lot of the testing being done in the United States at the moment is currently useless unless it gets a lot faster. And I do hope to get you more science on that from this Lancet article when I get the time to look at that. Now, the Rockefeller Foundation does a lot of research in this area in the States. So what are the Rockefeller Foundation saying about it, or their researchers saying about it? Well, the Rockefeller researchers are saying America faces an impending disaster. Unfortunately, but I agree. If it doesn't dramatically, not my words, theirs, if it doesn't dramatically increase testing. So 4.5 million tests a week now, 30 million a week needed by October. 30 million a week. Now, there are interesting new developments, breath tests, saliva tests, quicker tests, little machines that are portable and you carry around and do tests. So that 30 million a week by October is achievable if the technologists and scientists really get their act together on this. And in the United States, they are capable of that. The technical reservoir of expertise and manufacturing in the United States is better than anywhere else in the world, that they can do this. And I also hope they bash them out to the rest of the world at cost price as well. Because the Rockefeller are saying we need a 20-minute antigen test for the presence of the virus. Then you could isolate your contacts straight away. Because I know who I've come into contact with today and yesterday and the day before. That's doable, that's achievable. This is what we need. So the Rockefeller are saying everything, we can shut everything down. That's one option. So one option is to shut everything down. Another option is to let hundreds of thousands of Americans die. These are not my words. These are from the Rockefeller Research Foundation. Hundreds of thousands of lives are at risk here. Does that, try and get the import of this? Hundreds of thousands. Or testing is used as a way out. So the Rockefeller are saying option one, massive shutdown, close down the economy, close down everything, lock down the country, let hundreds of thousands of people die is the second option. Or the third option, get our act together on testing. I know which one I want. Now, we've already seen these distressing pictures of refrigerated morgues outside hospitals in some states. In Texas, the army have been deployed in a hospital that's particularly understaffed in Houston. So good to see that resources are being liberated here, but still unfortunate that the army is required. Now, Kevin Stitt is the governor of Oklahoma. And he actively pushed to reopen his state, but he's been diagnosed with COVID-19. And he reports of feeling fine apart from feeling a little bit achy. So I'm glad to see that he feels fine apart from being a little bit achy. I hope he doesn't develop acute respiratory distress syndrome. I hope he doesn't develop a form of disseminated intravascular coagulation. I hope he doesn't become critically ill, so he needs constant supplies of oxygen, probably pressurised oxygen. I hope he doesn't become even more critically ill and require a ventilator. I hope he doesn't need intravenous therapy to maintain his renal function. I hope he doesn't need dexamethasone to reduce the inflammation in his lungs caused by the acute respiratory distress syndrome. I hope he doesn't need low molecular weight heparin to prevent the clotting of his blood in his small blood vessels. I really hope he doesn't need all those things. Seriously, I hope he doesn't need them. So at the moment, he's feeling fine apart from being a little bit achy. Let's hope he's one of the majority who has a mild illness. Now, he felt pretty shocked. Pretty shocked. So let me summarise the situation. Kevin Stitt, who is the governor of Oklahoma, who with no reason to assume is not advised by the cleverest doctors and epidemiologists in Oklahoma, was pretty shocked that he got an infection during a pandemic. Imagine that. He got the infection during a pandemic. Get away. He was pretty shocked. I mean, I'm shocked that he was shocked. And I hope he doesn't get any of those complications that other people are currently suffering and dying of. And remember, he did actively push the reopening of his state. Glad to see that Mr. Stitt is quarantining away from his family and working from home. But of course, he would have been probably almost certainly symptomatic in the 2 days at least before he developed symptoms. Let's hope he didn't spread it around within the governorship of Oklahoma. Oh, this is good. I want to use my story to remind Oklahomans that if you aren't feeling well, you need to get tested. We agree with that, of course. So that's from the United States. Now, second country in order of of most cases at the moment is Brazil. Increasing numbers. We know these are massively underreported in Brazil. It would not at all surprise me if the real numbers in Brazil are very comparable with these numbers in the States. I wouldn't be at all surprised. Unfortunately, because we know there's huge underreporting and we know that deaths that are occurring almost certainly as a result of COVID-19 are not being attributed to it. Now, one of the things that we've talked about quite a bit on this video is the problems in the world that this virus is exposing. Problems of inequality, problems of malnutrition, other international and national problems, often related to various aspects of human nature, in my view. And another one that is highlighted and has been increasingly highlighted is the problem of endemic corruption. You know what corruption is? A few dollars in the back pocket. And that has been brought to light in many countries of the world, and I'm going to give one specific example now. We could have chosen quite a few countries here, but the news I've got available is from Bangladesh. Large population. Regent Dhaka hospital owner, this chap here, has been arrested. Now this is from a news report, so they're very cautious. Allegations he used thousands of fake negative coronavirus test results. He issued test results. So for the presumably the delivery of a corrupt payment, a cash payment perhaps, he will give you a certificate saying, no, you're negative. Now, the thing about Bangladesh is very poor country, very challenging environment, very hard-working people, but really crushed by a lot of poverty and corruption in that country. And many, many millions of people in Bangladesh work overseas to support their families and send the income back to their families in Bangladesh. So that means that to be able to travel, for example, to the Gulf for Bangladeshis is of immense importance. And to do this, very often they're going to need a certificate to say they don't have COVID-19. And yet this guy seems to have been, allegedly, falsifying these certificates. Do you see, this has got the potential for international spread from Bangladesh around the world. It's a disaster for Bangladesh, but it's also a potential disaster for other countries around the world. We had the same problem from Pakistan. Actually, the Pakistan airline, PIA, I believe it's currently completely closed down now. It's banned from European airspace because the pilots it were using had sometimes forged their qualifications or obtained the qualifications to fly aeroplanes corruptly. And I suppose you could say that's got the advantage of meaning that people who are positive from Pakistan aren't travelling to Europe at the moment. But the idea that a national carrier, this is the level of corruption we're talking about, that a national carrier could have airline pilots who weren't properly qualified pilots flying these aeroplanes is just unthinkable. Just imagine getting on an aeroplane and the pilot's not a pilot. Anyway, back to Bangladesh. Interesting that it does highlight these problems of corruption. Allegations, thousands of false negative certificates. So saying, okay, you're negative, you can go. Now, documented 10,500 coronavirus tests, 4,200 were genuine, and 6,300 test reports were given without conducting the test. That's not a bad little earner, this, is it? I should have thought of this. Won't bother doing the test. They're expensive. Here's the piece of paper. Just pay for it. But maybe pay half the amount. And here's your certificate, mate. We could make a few bob here, couldn't we? Let's take advantage of this pandemic to make money for myself. At the expense of the rest of the world, of course. But hey-ho, It's just unbelievable. Well, it's not unbelievable, unfortunately. It's endemic. Now, this gentleman was caught fleeing to India in a burqa. More than a dozen people detained by... It's not an isolated case. More than a dozen people detained by authorities in recent days for aspects of corruption. For saying people were virus-free without testing them. And apparently this chap from the Regent Dhaka hospital also accused of charging for treatments. If I can fit it in. Also accused of charging for treatments after agreeing that his hospital would provide free care. Again, presumably meaning that poorer people can go away because they can't pay. Now, Italy, kind of following on from that really, Italy has suspended flights to Rome from Bangladesh. So the Italian authorities have suspended the flights from Bangladesh into Rome. Several passengers arriving from Dhaka tested positive, some of whom tested positive in Italy were allegedly, again, newspapers being very careful, carrying negative coronavirus certificates from Bangladesh. So we had people from Bangladesh who apparently, allegedly, were coming into Italy with a certificate saying they were negative, but when the Italian authorities tested them correctly, they were found to be positive. And this is from Mr. Islam, who I understand does a lot of good work to support migrant rights, is a migrant rights campaigner. So he is advocating for these poorer people in Bangladesh who are obliged to work overseas to simply provide their families with the basic necessities of life. But it's sad that these people are now banned from making money or banned from flying into Italy. Just as it's equally sad that PIA is no longer flying people who can make money in Europe to feed their families in Pakistan. There's a human expense to all of these. Now, still in Italy, coronavirus directly caused 89% of pandemic deaths in Italy. Now, quite a lot of the way through this series, and since January really, there's been a question: are people dying from COVID-19, or are they dying with COVID-19? So were these people going to die anyway? It's just that they happened to have COVID-19 and they just died. They happened to have it anyway. So it wasn't the COVID-19 that was causing the death. That they would be people that died with it, but people that died from it, the death would be directly attributable to COVID-19. That's been the debate, with or from. And this data from Italy is saying very much that it's from. So 89% of the people that died, they died as a direct result of the infection. So that means, of course, that 11%, so in other words, 89% died from, that's what that means, and 11% just happened to die with it. So the vast majority are dying as a direct consequence of the COVID-19. The minority, 11%, just happened to have it when they would have died anyway. Not a major contributory factor. So that's what that means. Now, the remaining 11% of positive cases, so these people that died with, not from, the majority died from. In other words, these people would have carried on living for weeks, months, years, decades after, had they not got the COVID-19, this 89%. But the 11% of positive cases, those people that died with it, probably pretty well what you'd expect. Some died from cardiovascular disease, some from cancers, respiratory illness, diabetes, dementia, digestive system disorders. Now, the virus was fatal in 28.2% of those who had no coexisting illnesses. So this was a study of death certificates in Italy, and 28.2% of people that died had no coexisting illness. They were previously healthy. 71.8% had at least one other condition, so they had a comorbidity. So a lot of people in Italy died who did not have a comorbidity. So quite significant finding, really. Quite significant numbers didn't have a comorbidity. India, 125 people put under new lockdown in Bihar. Now Bihar, it's up near the border with Nepal, and it's one of the poorer states in India. So this is going to have real difficulties in Bihar. So often that a person and a family eats that night what they earn that day. So that lockdown is going to have real serious knock-on consequences, because Bihar is one of India's poorest states. France, the Prime Minister, masks will become compulsory in indoor public spaces next week, next few days. So if you're in France, start wearing it now, because it's going to be compulsory next week. Good sign. Now, another thing this has brought to light, this pandemic, is I had no idea there was so much mink farming. It's just unbelievable. Now, 93,000 mink in eastern Spain, in Aragon, are going to be killed. 80% of the mink have been infected with coronavirus. Farm workers have caught it from the mink. So clearly here we're seeing mink catch the infection. Mink can spread the infection onto humans. Why on earth are we farming mink when there are so many alternatives to mink coats now? And in fact, of course, I don't know what it's like where you're watching, but in English culture, it would be completely unacceptable. It would be culturally unacceptable to wear a mink coat because of the whole fur debate. It would be unacceptable. No, I don't think anyone. Well, in my circles, no one would ever wear mink coats anyway. But I think even in the sort of more exclusive esoteric circles where mink coats were worn in the past, maybe in the 1940s or 50s or something, then I think it would be unacceptable now. So where on earth all these mink furs are going, I've no idea. I assume it must be China or somewhere, but pity, because completely unnecessary. Catalan, 3 districts in Barcelona must stay indoors. So what we're seeing here in Spain is a regional lockdown as it's required. Northeast Italy, 160,000 people locked down. The rest of Spain under much more limited restrictions. People in these areas are allowed to leave to go to work, buy food, medication, or to exercise. In other words, they're locked down. But most of the country is not. So it's a bit like Leicester in this country. So there's a regional lockdown, depending on the outbreaks or the flare-ups at the time, which makes sense. Now, Melbourne, the story of how, or the account of how the infection flared up again in Melbourne has taken a new twist. Second wave, or continuation of the first wave. Security guards admitted having sex with quarantine travellers in the Stamford Plaza Hotel in Melbourne. So what happened was, I've actually got an email here from Australia. The Victorian government chose to use security guards in inverted commas to ensure correct running of the 14-day quarantine hotel, but they basically weren't up to the job. Some security guards believe that COVID-19 is similar to seasonal flu. So they didn't really follow the protocols, allowing people in quarantine to go shopping. Some exchanged intimate favours for those in quarantine for time outside the quarantine hotel. Now, I can't verify this. This is an email I've got from Australia. But hard to believe. Now in some areas, many areas, official officers were used to regulate. Well, first of all, it shouldn't be necessary to regulate quarantine. Everyone should do it. But given that it needs to be regulated, a lot of areas used officials like police officers and things like that, who did the job properly, of course. But here, these security guards abuse their position of power, and if you have sex with an inequality of power, then I guess that would be rape by some definitions. I don't know. It's not my field. Maybe some lawyer can tell me that. But there's clearly an inequality of power between the guards and the people that are quarantined. So quite disgraceful and outrageous. And the good thing about Australia is they're doing phylogenetic links. Phylogenetic links, so that they are looking at the genetics of the virus to work out where they came from. Another cluster was at a religious college in Melbourne. 76 students testing positive. Now 160 cases are linked to that single outbreak, indicating, unfortunately, community transmission. Now listen to a video with Brett Sutton, who seemed pretty on the ball. He's the Victoria Chief Medical Officer, and he was making a lot of sense. Numbers reflect behaviour and morbidity from 10 days or more ago. Numbers reflect behaviour and mobility from 10 days ago. In other words, what people were doing 10, 11, 12, 13, 14, 15, 16, 17 days ago, now coming to the fore. He didn't specify much on that, but that's what he was saying. He did say that additional measures may be required, and this was very concerning. Quite a few cases seem to be taking weeks or months to recover. So are these longer term sequelae, as we've talked about before on this channel, or are they that people are taking longer to recover in Australia for some reason? Concerning. Let's hope that's not a trend. Several cases still ill some weeks after. But for the Chief Medical Officer, Dr. Sutton, who obviously knows what he's talking about, you can tell. Everything he was saying was making sense. Then that is concerning that he should flag that up, that there may be longer term illnesses in that particular Australia outbreak. Now, there has been an outbreak in Sydney as well, up in New South Wales. So the Sydney cluster, this is from Dr. Jenny Muster. I can't remember who she is now. She's some senior doctor there. Now, apparently the spread in Sydney was spread by a 50-year-old man from Melbourne. Now, they know this because, again, they've done the phylogenetics. they've looked at the particular genetic traits of the virus in Sydney and realised that they are direct descendants. In fact, I think they are identical to the viruses which were causing the outbreak in Melbourne or parts of Melbourne. This chap crossed the border just before it closed, and he worked there through the day of the 3rd of July. And apparently after work they all went to a party that night in the Crossroads Hotel, and that's what seemed to kick off the southwest Sydney cluster. But I must say, I've been very impressed with people like Dr. Sutton and Dr. Musto, who do seem to be talking a lot of sense. They do seem to be instigating control measures. They do seem to be doing that without political interference. So I wouldn't say I'm optimistic about Australia. There's a lot of community spread, as we saw from that religious college. But it seems to be the generals that are in charge of the war, not the politicians, which of course was one of the great lessons of the Second World War, wasn't it? Okay, so sorry, I've gone on a bit there this morning. I think we'll leave the bit on, or this afternoon it is now. I think we'll leave the bit on the rest of the year and the vaccine for another video now.